If you're over altmush, there's one hidden danger that could be quietly raising your risk of a stroke. While you sleep, no warning, no pain. One moment you're fine, and the next, you can't lift your arm. Your words come out slurred, or your balance suddenly disappears. As a brain specialist who has spent decades helping older adults prevent and recover from strokes, I've seen far too many lives change in the blink of an eye. Often not because of smoking, poor diet, or lack of exercise, but because of something people thought was helping them: vitamins. Yes, really. Vitamins. Every day, millions of seniors take supplements to protect their bones, boost their energy, or keep their memory sharp. And while many of them do exactly that, some, especially when taken in high doses or at the wrong time, can quietly put your brain and your life at risk. The danger is that you won't feel it coming. You'll go to bed feeling perfectly fine, and you may wake up with your life forever changed. That's why, in today's video here on Improve Senior Health, I want to reveal one overlooked set of warning signs that could mean a stroke is coming, and then walk you through 5 common vitamins that, if misused, could trigger that nightmare. Each one is backed by real patient stories from my years of practice, so you'll see exactly how this can happen, and how to stop it before it does. Before we begin, I'd love to hear from you. Do you take vitamins regularly? Have you ever experienced symptoms like sudden numbness, dizziness, or slurred speech? Type yes in the comments if you have. And let's start this conversation. And of course, don't forget to like this video and subscribe to Improve Senior Health so we can keep sharing science-backed, life-saving tips made for seniors like you. When Mrs. Linda Carter, a 72-year-old retired schoolteacher, came to see me, she didn't think anything serious was wrong. "Doctor," she began, "last week, while pouring tea, my right hand suddenly felt weak, and the cup slipped. It only lasted a few seconds, so I didn't think much of it. Then, 2 days later, while chatting with my neighbor, the words in my head just wouldn't come out right for a moment. Then it passed, so I ignored it." Her story is far more common than most people realize. These brief, fleeting episodes are often dismissed as fatigue, stress, or just getting older. But as a brain specialist, I can tell you, they are not normal. They can be warning shots, what we call transient ischemic attacks, or TIAs. Think of them as a mini-stroke. The symptoms vanish quickly, but the danger is very real. A TIA means there's a blockage or disruption in blood flow to the brain, and it's your body's way of saying, a bigger stroke could be next. The signs can be subtle, but you must treat them seriously. A sudden numbness or weakness in your face, arm, or leg, especially on one side of the body, speech that becomes slurred, or the inability to find the right words, sudden loss of vision in one eye, or partial blindness, unexpected dizziness or loss of balance, a sudden, severe headache, unlike anything you've felt before. Here's what makes TIAs dangerous. They often stop within minutes, and when the symptoms fade, people think they're safe. But studies show that within 48 hours of a TIA, your risk of a major stroke is highest. This is the moment to act, not to wait. When I examined Mrs. Carter, a brain scan revealed narrowing in one of her carotid arteries. We were able to treat it, adjust her medications, and set her on a prevention plan. She told me later, "I almost didn't come a doctor. If I'd waited, I might not be here." I want you to remember her story. If you experience any of these symptoms, even for a few seconds, Do not wait for them to pass. Don't sleep on it. Don't wait to see how you feel in the morning. Call emergency services immediately. A warning stroke can be a blessing if you act on it. Ignore it. And it could be the last chance you get to protect your brain. Now that we've addressed these silent red flags, it's time to look at another hidden risk. One that might already be sitting in your medicine cabinet, a common vitamin that, if taken the wrong way, could quietly raise your chance of a stroke. You've probably heard that vitamin D is essential for strong bones, a healthy immune system, and even a better mood. And that's true, when it's taken in the right amount and at the right time. But what most seniors are never told is that too much vitamin D, especially if taken late in the day, can quietly set the stage for a stroke while you sleep. One of my patients, Mr. Walter Hayes, was a 74-year-old retired Navy veteran. He was disciplined about his health, lined up his supplements every morning, and never missed a dose. Among them was a 10,000 IU capsule of vitamin D he had bought over the counter. He believed more was better, especially for protecting his bones. But what he didn't realize was that this high daily dose was slowly causing calcium to build up in his bloodstream. When you take too much vitamin D, your body absorbs more calcium than it can handle. And unlike water-soluble vitamins that flush out easily, excess calcium circulates in your blood, eventually depositing into your arteries. This process stiffens and narrows them, making it harder for blood to flow freely. In older adults, whose arteries are already less flexible, this can be a dangerous combination. Add dehydration, poor sleep, and a nighttime calcium spike, and you have the perfect storm for a clot to form while you're in bed. That's exactly what happened to Mr. Hayes. One morning, his wife found him sitting on the edge of the bed, unable to speak clearly, and with his right arm limp. He had suffered a stroke during the night. His blood tests showed dangerously high calcium levels, and his scans revealed hardened arteries. The culprit wasn't high blood pressure or cholesterol. It was vitamin D toxicity. Here's the tricky part. Many over-the-counter vitamin D supplements in the U.S. contain 5,000 to 10,000 IU per capsule, several times more than most seniors actually need. For many healthy older adults, 600 to 800 IU daily is enough. And even those with deficiencies often do well with 1,000 to 2,000 IU under medical supervision. Anything beyond that, especially without regular blood tests, can push your calcium to harmful levels. Timing matters too. Taking vitamin D in the morning allows your body to use and regulate calcium during the day. When you're active and hydrated, taking it at night can increase the chance of calcium spikes while your circulation is naturally slower, which may raise the risk of clot formation. My advice is simple. Know exactly how much vitamin D you're taking from all supplements combined. If you're also taking calcium pills or heart medications, the need for monitoring is even greater. Ask your doctor for a blood test every few months to check your vitamin D and calcium levels. And unless you've been instructed otherwise, take your vitamin D in the morning with food. Mr. Hayes is recovering now, but his right hand still trembles, and his speech is slower than it used to be. He told me, "Doctor, I thought I was protecting myself. I didn't know I was building my own trap." Up next, we'll talk about another heart helper vitamin that, in high doses, especially when combined with certain medications, can trigger something even more dangerous than a clot bleeding in the brain. Vitamin E is often called the heart helper. For years, it's been promoted as a way to improve circulation, boost memory, and keep skin looking youthful. And while it does have benefits in small amounts, high doses, especially when combined with certain medications, can turn this supposed helper into a dangerous threat, particularly for your brain. One of my patients, Mrs. Evelyn Brooks, an 81-year-old retired librarian, was as sharp and witty as they come. She had a heart valve condition and was taking warfarin, a common blood thinner, under careful medical supervision. Her blood work was stable, her blood pressure under control. Then one day, she saw an advertisement for a natural vitamin E supplement in a magazine, 800 IU per capsule, and decided it could help her memory and circulation. She started taking it daily. Thinking it was harmless, 3 weeks later, she was rushed to the emergency room with a pounding headache, vomiting, and confusion. A brain scan revealed a hemorrhagic stroke, bleeding inside the brain. The cause wasn't high blood pressure or a fall. It was the combination of warfarin and high-dose vitamin E, which had thinned her blood so much that a tiny vessel in her brain burst. Here's what most people don't realize in high doses. Vitamin E acts like a natural anticoagulant. It slows blood clotting. If you're already on medications like aspirin, Plavix, or warfarin, adding vitamin E can tip the balance too far, raising the risk of internal bleeding, especially in the brain. And you won't find a warning about that on most supplement bottles. The recommended daily allowance of vitamin E for older adults is just 15 milligrams, about 22 IU. Yet many supplements sold in stores contain 200, 400, or even 1,000 IU per capsule, 10 to 40 times more than you need, taken daily for months or years. Especially with blood thinners, this can be a recipe for disaster. Mrs. Brooks survived, but she now walks with a cane, and her short-term memory has never been the same. She told me, "I thought I was helping myself. I didn't know I was making things worse." My advice, if you're on any medication that affects clotting, do not start vitamin E without talking to your doctor. Check your supplement labels. Remember that vitamin E can be hidden in multivitamins, heart health formulas, and even skin supplements. More is not better. With vitamin E, the safest dose is the one your doctor recommends for your specific needs. Next, we'll move on to a vitamin often marketed for nerve support and brain health. But in high doses, it can actually damage your nerves permanently. Vitamin B6 is often marketed as a nerve support or brain booster. You'll find it in supplements claiming to improve memory, focus, energy, or circulation. And yes, B6 is essential in small amounts. But here's the part most people never hear. Too much B6 can actually damage your nerves. And in some cases, the damage is permanent. One of my patients, Mr. Harold Jenkins, was a 76-year-old retired truck driver. He came to see me because his feet felt numb, his hands tingled, and his balance was getting worse. At first, he thought it was just aging, or maybe arthritis, but the problem escalated. He started falling, once in the kitchen, then again in the bathroom, hitting his head. When I reviewed his supplements, the answer was obvious. He'd been taking a brain health and circulation formula for over a year. Each tablet contained 100 milligrams of vitamin B6, and he was taking 2 tablets a day. That's 200 milligrams daily, more than 10 times the safe upper limit for older adults. Here's the danger: unlike water-soluble vitamins that flush out easily, B6 builds up in your system over time. High doses can strip away the protective coating around your nerves, the myelin sheath. Just like removing insulation from a wire, this leads to tingling, numbness, weakness, tremors, balance problems, and even memory issues. And because the damage develops slowly, many people think it's something else: arthritis, poor circulation, or even early dementia. The recommended daily allowance for older adults is just 2 to 10 milligrams per day, including what you get from food, but many nerve support or energy supplements contain 50 or even 200 milligrams per serving, taken for months or years. These doses can cause irreversible harm. Mr. Jenkins was lucky. We caught it early enough to stop further damage, but he still uses a cane, and he no longer drives. He told me, "I just wanted to protect my brain. I didn't know I was poisoning it." My advice: check every supplement you take for vitamin B6 content, not just standalone pills, but also multivitamins, energy drinks, and brain formulas. Add up the total from all sources. If it's above 10 milligrams a day, talk to your doctor about lowering it. With B6, more is not better. In fact, too much can take away the very independence you're trying to protect. Next, we'll look at a vitamin often associated with eye health, skin, and immunity, but in high doses. It can raise pressure inside your skull and mimic the symptoms of a stroke. Vitamin A is often praised for supporting eye health, boosting immunity, and keeping skin healthy. And while it is essential in small amounts, in high doses, especially over long periods, it can become toxic and even mimic the symptoms of a stroke. Take the case of Mrs. Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She loved music, stayed active, and valued her independence. For years, she took a high-dose skin and eye health supplement, 10,000 IU of vitamin A every single day, without realizing that she was getting even more from her multivitamin and diet. Over time, she began to experience headaches, blurry vision, dizziness, and eventually slurred speech. Her family feared she was having a stroke, but when we ran her scans, there was no clot and no bleeding. Instead, she had elevated intracranial pressure, too much pressure inside her skull. The culprit: vitamin A toxicity. Here's why this happens. Vitamin A is fat-soluble, meaning it's stored in your liver, tissues, and even your brain. Unlike water-soluble vitamins, it doesn't flush out easily. In older adults, the liver processes it more slowly, so it can build up over months or years. Too much vitamin A can cause a condition called pseudotumor cerebri, literally a false brain tumor. Symptoms include headaches, blurred or double vision, dizziness, nausea, and in severe cases, permanent vision loss or cognitive decline. The tricky part is that many multivitamins already contain the full daily recommended amount, around 2,500 to 3,000 IU for seniors. Adding separate eye or anti-aging supplements on top can double or triple that intake without you realizing it. Some products sold online even contain 5,000 to 10,000 IU per capsule, which can be dangerous if taken daily without medical supervision. Mrs. Simmons is now in treatment, but her vision has not fully recovered, and she needs regular pressure checks and balance therapy. She told me, "I thought I was doing something good for my body. I never imagined it could hurt my brain." My advice: check your supplement labels for vitamin A content. And remember that it may also appear as beta-carotene. Avoid taking more than 3,000 IU daily unless your doctor specifically prescribes it for a short period. And always consider your total intake from both food and supplements. Next, we'll look at a vitamin often recommended for cholesterol and heart health, but in high doses, it can raise your blood pressure and even trigger a stroke. Niacin, also known as vitamin B3, is often recommended to help lower cholesterol and improve circulation. Some doctors prescribe it, and you'll also find it in heart health supplements. fortified cereals, and even energy drinks. But in high doses, niacin can quietly create dangerous swings in your blood pressure, and in some cases, trigger a stroke. One of my patients, Mr. Frank Miller, an 82-year-old retired postman from Florida, came to see me with a puzzling set of symptoms. He described hot flashes in his face, a pounding sensation in his chest, and brief episodes of dizziness, especially in the morning. His wife thought it was anxiety. His son blamed it on his blood pressure medication, but the real culprit was hiding in plain sight. Frank had been taking an over-the-counter cholesterol support supplement. The front label promised better heart health. The back revealed each serving contained 1,000 milligrams of niacin. He was taking it twice a day. 2,000 milligrams total. Over 60 times the amount most seniors need. Here's what happens in high doses. Niacin causes your blood vessels to dilate rapidly, which is why your face may flush and feel warm. But shortly after, those same vessels constrict again, sometimes more tightly than before. This rapid change can spike your blood pressure, strain your heart, and reduce blood flow to your brain. Over time, these repeated yo-yo effects on your circulation can crack fragile blood vessels or starve parts of your brain of oxygen. That's exactly what happened to Frank. One morning, he had slurred speech for about 2 minutes before it resolved. A transient ischemic attack, or mini-stroke. Thankfully, it left no permanent damage, but it was a serious warning. For most older adults, 14 to 16 milligrams of niacin a day from food is plenty. Even for cholesterol management, doses above 50 milligrams daily should only be taken under medical supervision. Flush-free or extended-release niacin may seem safer, but they can still raise blood pressure, trigger irregular heart rhythms, and affect blood sugar. My advice: always read your labels carefully. Niacin can hide in multivitamins, fortified foods, and energy drinks, adding up without you realizing it. If you have high blood pressure, heart rhythm problems, or are on medication, check with your doctor before taking any niacin supplement. Now that we've covered the 5 vitamins that can secretly raise your risk of stroke, let's turn to the conclusion. How to protect your brain and heart safely, and the simple food-based strategies that can do more for your health than any high-dose pill. Far too many older adults take high-dose vitamins for years, never realizing the hidden risks. Over time, what seems like a healthy habit can quietly work against your brain, your heart, and your independence. The truth is, your body was never meant to depend on pills. It was designed to thrive on real, nourishing food. I've seen remarkable changes when patients make that shift. One of them, Mrs. Margaret Wilson, age 73, had a countertop lined with bottles. Vitamin D for her bones, B complex for energy, niacin for cholesterol. Yet she still felt lightheaded in the mornings, and her blood pressure was creeping higher each month. Together, we cleared away the clutter and focused on simple, balanced meals: a boiled egg for clean protein, half an avocado for healthy fats, a slice of whole grain bread for steady energy, a handful of berries rich in antioxidants, a few walnuts, and a glass of water at room temperature. Within just weeks, her pressure stabilized, her energy returned, and she told me her mind felt clearer than it had in years. If you take one thing from today, let it be this: always read your labels. Speak to your doctor before taking any high-dose vitamin, especially if you're on medication. And most importantly, listen to your body. Small changes in how you feel can be early warning signs you can't afford to ignore. So, what about you? What's one change you're ready to make? Starting tomorrow, share it in the comments. Give this video a like if it helped you. and subscribe to Improve Senior Health so we can keep learning, growing, and protecting your health together.